The ring at the base of the cord must be positioned in the gutter on the tip of the pliers. Wide open the pliers to facilitate the procedure. To adjust the cord, pull the knot. The universal tip has 3 different contact surfaces for the anchorage to the cervical line of the tooth, large, medium and small, adapting to the different shape of the tooth. A correct choice of the contact surface guarantees a better and more stable grip on the tooth. The universal tips are so defined since they adapt to all the different teeth. To adjust the tips to the specific shape of the tooth, rotate the tips until you find the larger portion of contact surface and consequently a stronger grip on the tooth. The universal tips can be used in both positions, vertically and horizontally on the tooth. The extractor is positioned on the teeth by means of 6 different supports. Two supports for teeth having the crown. 2 supports for edentulous areas. 1 support for the 8 inferior molars and 1 support for the 8 superior molars. The supports must be tight screwed into the holes on the extractor. Adjust the height of the supports according to the case. It is very important to keep the extractor as much as possible parallel to the occlusal plane. For anterior teeth, pay special attention to the inclination of incisor teeth. The extractor can be positioned on edentulous areas using the supports 3 or 4 higher and thinner in shape. We remind you that the extractor and the occlusal plane must stay parallel to obtain stability and the best distribution of the load. In the case of fully edentulous areas, use only the supports 3 and 4. For the extraction of the 3rd inferior molar, use the specific support 5. For the 3rd superior molar, use the specific support 6. As the retromolar region is a very complex and delicate area, before the extraction of the superior third molar, check accurately the anatomical state of this portion to evaluate whether it will stand the pressure of the support during the extraction. Once the Kevlar cord and the universal tips are fitted to the pliers, position the pliers on the tooth to be extracted. Make sure that you are choosing the best possible contact surface, ensuring the optimal adherence and hold on the tooth. Anchor the pliers to the tooth following the fast adjustment and the slow adjustment procedures. The extractor can be positioned above the plier or under the pliers, depending on the available space. Insert the cord into the hole number 1 of the extractor and fasten it to the hook of the sliding rail located on the opposite side of the extractor. Proceed with the fast adjustment procedure until the point of tension of the cord. Once the cord is in tension, rotate clockwise the little wings of the slow adjustment. The extraction is obtained through the gradual rotation of the little wings. Rotate the wings, wait for 10 seconds at each half turn, proceed until full extraction. The interval of 10 seconds is necessary to allow the periodontal ligament to absorb the stress. The ligaments relax smoothly, thus preventing the risk of lacerations and huge damages. Rotate the wings of the slow adjustment exclusively with the fingers. Do not use any tool. To extract a root, use the root screws supplied in 2 different sizes. 4 screws diameter 16 and 1 screw diameter 18. Use screw 18 only if 16 has not found a full and stable hold in the canal you have prepared on the root. Use a burr to drill the canal for the insertion of the root screw. Assemble the extender to the burr in case of very deep roots. Use the short or the long screwdriver according to the position of the teeth. Screwdriver and screw are kept together by a magnet inside the screwdriver. Once the screw is set into the canal, remove the screwdriver. For root extractions, replace the universal tips with the specific prismatic tips. The pliers must be anchored to the screw. Use fast adjustment and then slow adjustment for full anchorage. Position the extractors set up with the best fitting supports. Fasten the cord to the hook on the sliding rail of the extractor. Pull the cord following the fast adjustment until the point of tension. Once the cord is in tension, rotate clockwise the little wings of the slow adjustment. The extraction is obtained through the gradual rotation of the little wings. Rotate the wings, wait for 10 seconds at each half turn, proceed until full extraction. In case of remaining root fragments, use one of the two supplied manual root extractors, two different sizes depending on the depth of the root. Evaluate the patient's X-ray image before manually inserting by clockwise rotations the extractor into the root. Once the extractor is fully anchored to the root fragment, pull it out to complete the extraction. Should you find difficulties in tightening the extractor, prepare the canal using the burr or burr plus extender, then proceed with the manual extraction.